Hello everyone. We will be covering the topic depression in this session. It is one of the three modules under the Geriatric giant. Without further ado, let's begin our lesson proper. Our learning objectives are as follows. We hope that at the end of the lesson you will be able to define depression, learn more about the signs and symptoms of depression, assess the elderly for depression using the Geriatric Depression Scale, and finally, introduce you to the available resources that can help people with depression. So, what is depression? It is not just about feeling sad, because everybody experiences sadness at some point in our lives. Depression is a psychiatric illness that needs to be treated, and it is marked by persistent low mood, loss of interest in almost all activities, severely affecting an individual's functioning for at least 2 weeks. It is the most common psychiatric disorder among the general population. Here are some statistics of depression in our local context. 6% of the elderly population aged 65 and above are diagnosed with depression, and approximately 11.4% of the community-dwelling older population aged 65 and above have depressive symptoms. This is a problem because mental illness is not part of normal aging, and depression in particular is a common occurrence in the elderly. This is made worse because depression in older adults are often underreported, thus underdiagnosed and undertreated. Depression poses a significant risk for suicide, and there are high rates of completed suicides. For those with depression, their quality of life and functional ability are adversely affected. Thus, it is important that we learn how to recognize those with depression and direct them to the help required. Now, we will go on to talk about the causes and risk factors for depression. These include triggering or major events such as loss of spouse or significant others, or it could be changes in one's role and responsibility. Next would be social isolation and loneliness. This is especially significant for elderly living alone or have poor social support, but more will be covered in the next video on social isolation and loneliness. Also, those with previous psychiatric history or family history of psychiatric illnesses have a higher risk of developing depression. Other risk factors for late-life depression include demographic factors such as the female gender. In general, the prevalence of depression is higher in women across all age groups. Another demographic factor is low socioeconomic status. The risk of depression also increases with functional and cognitive impairments, such as a recent onset of physical disability, having to deal with multiple diseases or medical conditions, having insomnia, and poorly treated pain. The signs and symptoms of depression include feeling sad, empty, worthless, or even excessive guilt, having loss of interest in most or all activities, having recurrent thoughts about suicide and death, changes in appetite or weight. Some may complain of fatigue, poor concentration and memory, insomnia or hypersomnia, anger and irritability. We will now move on to find out more about the treatment of depression. Treatment can be divided into drug therapy and non-drug therapy. For drug therapy, the commonly used antidepressants include monoamine oxidase inhibitors, selective serotonin inhibitors, tricyclics, and lithium. Here are some things to note for antidepressants. In its acute phase, antidepressants should be continued for 4 to 6 weeks, as all antidepressants take this amount of time to achieve their maximum therapeutic effects. Physical symptoms such as sleep and appetite improves in 2 to 3 weeks, while mood symptoms improves in 4 to 6 weeks. In the continuation phase, Patients with first episode of depression without psychotic symptoms should be treated with antidepressants at full treatment dose for at least 6 months. Finally, it is important to maintain medication in patients with risk factors for recurrence. For non-drug therapy, psychotherapy is a treatment option for mental health issues where an individual speaks to a psychiatrist or psychologist to identify and learn more about their feelings, thoughts, mood, and behavior. CBT is a form of psychotherapy where individuals challenge their negative thinking and self-defeating behavior and replace it with thoughts that are more positive and balanced. Another form of psychotherapy is art therapy. This allows individuals to express their feelings and thoughts in the form of art. This is not restricted to people who are good in art. Electroconvulsive therapy is another treatment option where small electric currents are delivered through the brain to induce a brief episode of seizure. ECT has been shown to alter brain chemistry and reverse symptoms of certain mental conditions such as depression. This procedure is done under general anesthesia, where the individual is put to a sleep-like state prior to the procedure, and they will be closely monitored throughout. Relaxation therapy is another treatment option that teaches an individual how to relax voluntarily. Some relaxation techniques include deep breathing exercises, progressive muscle relaxation to help relieve physical and mental tension. Lastly, regular exercise is a mood booster, as it may ease symptoms of depression by releasing endorphins, which helps us feel good. There are many community resources available for our seniors. Each of these organizations have different aims pertaining to older adults. For Agency of Integrated Care, it is a platform that aims to connect caregivers and seniors to services and information they need to stay healthy and age gracefully. For Huame Center of Successful Aging, they aim to provide primary health and psychosocial care for people aged 40 years and above. Next would be Lions Befriender. I'm sure some of you have come across this before. It aims to provide befriending services to help seniors lead enriching and meaningful lives. Old Joy Care Services and the Seniors Helpline both provide counseling for any adult aged 50 and above, with the aim of preventing and providing early intervention for potential mental health issues and to aid the older adults to age healthily. Now, I will go on to share how we can identify an older adult with depression. We will be utilizing a screening tool, which is the Geriatric Depression Scale, to do so. In the next slide, I will be showing you the questions for this screening tool, but now I will explain the broad idea of how it works. The elderly will score 1 point if their answer is similar to the bolded response, which you will see in the next slide. A score of more than 5 points is suggestive of depression and should warrant a follow-up comprehensive assessment. A score of more than 10 points is almost always indicative of depression, and we should refer the elderly to a psychiatrist early for evaluation and treatment. This is the Geriatric Depression Scale, and there are 15 questions in total. As mentioned earlier, if the elderly's answer is similar to the bolded answer, they will score a point. Let me give you an example. For the first question, are you satisfied with your life? If the elderly's answer is no, they will score a point. If the elderly's answer is yes, they will not score a point. As you go through the questions, take note of the elderly's response and total it up to find out their score. Can you still remember a score of more than blank is suggestive of depression? Yes, the answer is more than 5. And a score of more than 10 is almost indicative of depression. Great job! So, what can we do to counter depression in your elderly? Here are 3 steps that we can take. First, we evaluate by assessing for signs and symptoms of depression and taking note of red flags, especially during conversations with them. Second, we can encourage them by showing compassion, lending them a listening ear, spending more time by calling or going for home visits, and encouraging them to engage in physical activities and simple exercises to lift up their mood. Lastly, we can empower them by connecting them to befriending programs or senior activity centers, or engage caregiver and enhance family support if possible. Alternatively, you can come up with creative ideas to help them find meaning in life. In conclusion, these are our key takeaways. The first, depression is a psychiatric illness marked by a persistent low mood and loss of interest in almost all activities, affecting an individual's functioning for at least 2 weeks. Next, treatment include drug and non-drug therapy, such as psychotherapy. And lastly, geriatric depression scale can be used to identify one with depression. To sum up, here are some reflection questions that you can spend some time thinking about. And here is a continuation of the previous slide.
To consolidate your knowledge, please scan the QR code and attempt the quiz. Alternatively, you can access the quiz using the link shown in the slide.
Thank you for your attention, and we hope that you have learned something new from this lecture.